Have you ever wondered what exactly happens to your body during chemotherapy? It's a question that's been asked by many, a question that stems from curiosity, concern, or a quest for understanding. Chemotherapy, a word that's tossed around quite often, but what does it truly mean? What happens when those drugs enter your bloodstream, and how do they wage war against the invader that is cancer? Today, we aim to answer that question and demystify the process of chemotherapy. To understand chemotherapy, we first need to understand what cancer is. Cancer, in simple terms, is a rebellion of the body's own cells. You see, our bodies are composed of trillions of cells, all working in harmony. However, occasionally a few cells go rogue. Rather than growing and dividing in an orderly manner, they begin to multiply uncontrollably, forming a mass known as a tumour. These malignant tumours or cancers can invade nearby tissues and spread to other parts of the body through the blood and lymph systems. So, how does this relate to chemotherapy? Well, the primary objective of chemotherapy is to halt this cellular rebellion. It's a bit like sending in an elite squad to quell an uprising. Yet instead of soldiers, we're using powerful drugs, specifically designed to target and destroy these rebellious cancer cells. Chemotherapy drugs work by interrupting the cell cycle, the process by which cells grow and divide. Some drugs damage the DNA of the cancer cells, preventing them from dividing and growing. Others target the structures within the cells that are necessary for cell division. In either case, the goal is the same: to halt the growth of cancer cells and ultimately to reduce the size of the tumour. However, it's important to note that chemotherapy is not a sniper, picking off individual cancer cells with pinpoint accuracy. It's more akin to a carpet bombing campaign, affecting not only the cancer cells but also some healthy cells. This is because chemotherapy drugs can't always distinguish between healthy cells and cancer cells, leading to some of the side effects associated with chemotherapy. Despite this, chemotherapy remains a cornerstone of cancer treatment. It can be used alone or in conjunction with other treatments like surgery and radiation therapy. The specific drugs used, the dosage, and the schedule of chemotherapy treatments are all carefully tailored to each individual patient's condition and type of cancer. Chemotherapy, in essence, is a medical strategy wielding powerful drugs to battle cancer. But how does chemotherapy actually work? Well, let's delve into that. Chemotherapy is a type of cancer treatment that uses drugs to destroy cancer cells. There are over 100 different chemotherapy drugs, and they all work in slightly different ways. Primarily, chemotherapy drugs work by interfering with a cancer cell's ability to divide and reproduce. You see, unlike healthy cells, which have a controlled cycle of growth and division, cancer cells divide and grow in a rapid, uncontrolled way. Chemotherapy drugs disrupt this process, preventing the cancer cells from dividing and therefore growing. There are different types of chemotherapy drugs. Some are cell cycle specific, which means they target cells at different stages of their cycle. These are particularly effective against rapidly growing cancers. Other types of drugs are cell cycle non-specific, meaning they target cells at any stage in their cycle, including the resting phase. However, it's important to note that chemotherapy doesn't distinguish between cancer cells and some types of healthy cells. Like cancer cells, certain healthy cells, such as those found in your bone marrow, the lining of your mouth and intestines, and your hair follicles also divide rapidly. When chemotherapy drugs target these cells, it can lead to side effects. These might include fatigue, hair loss, and an increased risk of infection due to a lowered white blood cell count. Yet despite these potential side effects, the primary goal of chemotherapy is to kill as many cancer cells as possible, while minimally affecting healthy cells. Doctors carefully consider the type of chemotherapy drug, the dosage, and the timing of treatment to achieve this delicate balance. Chemotherapy can be used alone or in combination with other treatments like radiation therapy or surgery. It can be used to shrink a tumour before surgery, kill any remaining cancer cells after surgery, or to control tumour growth and extend a patient's life when cure is not possible. Despite its potential side effects, chemotherapy remains a powerful tool in the fight against cancer. Chemotherapy might seem daunting, but it can be a life-saving treatment. This powerful tool in the fight against cancer has been honed and refined over many decades, and today it offers a range of benefits that can make a significant difference in the lives of those battling this disease. Firstly, chemotherapy has the potential to prolong life. For some, it can add years or even decades to their life expectancy, giving them the opportunity to see their children grow up, to celebrate milestone anniversaries, or to enjoy the simple pleasures of everyday life for longer. Secondly, chemotherapy can help to reduce the symptoms of cancer. This can mean a significant improvement in quality of life for many patients. It can alleviate pain, reduce the size of tumours, and combat other symptoms like fatigue or loss of appetite. But perhaps the most incredible benefit of chemotherapy is its potential to eliminate cancer entirely. For some types of cancer, chemotherapy can eradicate the disease, giving patients the chance to live a cancer-free life. This is the ultimate goal for many undergoing treatment, and while it's not always achievable, the possibility is a powerful motivator. Of course, chemotherapy is not without its challenges. It is a rigorous and demanding treatment that can have significant side effects. However, medical science has made great strides in managing these side effects, and for many patients, the benefits of chemotherapy far outweigh the difficulties. It's important to remember that each patient is unique, and what works best for one person may not be the best option for another. But for many, chemotherapy offers hope and the possibility of a future free from cancer. The benefits of chemotherapy can far outweigh its challenges for many patients. It can offer a lifeline in the face of a devastating diagnosis, giving patients the chance to fight back against cancer and to live their lives on their own terms. Nevertheless, it's important to be aware of the challenges associated with chemotherapy. Chemotherapy, while a powerful tool in the fight against cancer, is not without its difficulties. This treatment can sometimes feel like a double-edged sword, as it often comes with a range of side effects. Commonly, patients may experience fatigue. This isn't the kind of tiredness that a good night's sleep can remedy. It's a deep, persistent exhaustion that can make even the smallest tasks feel monumental. Fatigue can linger for weeks or even months after treatment. It's a difficult hurdle, but understanding it's a part of the journey can help. Another frequent side effect is nausea and vomiting. This is due to chemotherapy drugs being strong enough to kill cancer cells, but they can also affect healthy cells in the digestive tract. This can lead to discomfort and a loss of appetite, which can, in turn, affect overall health and recovery. But fear not, there are medications available to help manage these symptoms. Perhaps the most well-known side effect of chemotherapy is hair loss. This can be particularly distressing for many, as our hair is often tied to our identity and self-esteem. But remember, this is temporary. Hair will usually begin to grow back a few weeks after treatment has ended. These are just a few of the potential side effects of chemotherapy. Others might include changes in taste or smell, difficulty concentrating, or feelings of anxiety or depression. It's crucial to remember that everyone's experience with chemotherapy is unique, and not everyone will experience all of these side effects. The key to navigating these challenges is open communication with your healthcare team. Discuss your concerns, ask questions, and never hesitate to report new or worsening symptoms. They are there to support you, to help manage these side effects and ensure your well-being throughout the process. Being informed about these challenges can help in making an informed decision about chemotherapy. Remember, knowledge is power, and understanding what to expect can make the journey a bit less daunting. So, we've learned about what chemotherapy is, how it works, and its pros and cons. In essence, chemotherapy is a potent drug treatment designed to kill rapidly dividing cells in the body. It's a powerful tool in our fight against cancer, a disease characterized by uncontrolled cell growth. We've delved into the science behind it, seeing how these drugs target cells at different stages of division and growth, interrupting the cancer's progression. We've also explored the potential benefits of chemotherapy. It can be curative, controlling disease, or palliative, easing symptoms. For many, it's a beacon of hope, a lifeline in a sea of uncertainty, but it's not without its challenges. The same mechanisms that allow chemotherapy to destroy cancer cells can also harm healthy cells, leading to side effects. We've talked about the common ones like fatigue, nausea, and hair loss, as well as the less common but more serious risks. Yet despite these challenges, chemotherapy continues to be a crucial part of cancer treatment. It's not a decision to be taken lightly, nor is it one to be made alone. It's a journey that should be embarked upon with the guidance of trusted healthcare professionals. taking into account the individual's overall health, type and stage of cancer, and personal preferences. Remember, knowledge is power. Understanding chemotherapy can help you or your loved one make the best decision in the fight against cancer.